So today we have got a really exciting, I've been really looking forward to listening to this seminar. It's just a great project to have Dara Shah and Nancy Spencer today talking about poverty and underemployment, women over 50 on an entrepreneurial journey. Let me tell you a little bit about our speakers and then they will hold the floor. And then can I also ask that if you've got a question, type it in on the side, please, and I will ask our speakers your questions at the end of their presentation. So Dara is a senior lecturer with research interests in gender issues, women's career, self-efficacy, cross-cultural adjustment, and Indian women. She is working on 2 research projects, an Australian government-funded social innovation, the Sisters Project, focusing on empowering disadvantaged women over 50, with research focusing on increasing self-efficacy among disadvantaged women through entrepreneurial learning, career motivations, labour market re-entry. She co-leads a Queensland government-funded project to understand motivations and challenges of Indian women social entrepreneurs embarking on an entrepreneurial journey. Our second speaker is Nancy Spencer, and Nancy has an extensive work experience with Queensland Government, primarily in the social portfolios, disaster management and security policy. Nancy is currently working with the Policy Innovation Hub, focusing on policy development and implementation, and working with Dara Shah on improving the self-confidence and independence of women aged over 50. Nancy is active in the not-for-profit sector, assisting organisations with governance, developing sustainable business models, and improving care and clinical governance. As you can tell, 2 amazing individuals, and I'm just so delighted to introduce them both today. Thank you, Dara, and thank you, Nancy.
Hi, everyone. Well, I'll start. So I'm Nancy Spencer. I'm from the Policy Innovation Hub, and my focus in this work with Dara is the policy implications coming out of the research. And I'm going to talk a little bit about who the women are that are in our group and where are they now, how did they get there, and then hand over to Dara to talk a little bit more about the research side of the project. So the women that we're focusing on are women who are over 50. These are women who commenced work after school or after uni in the 70s and 80s when compulsory super was not introduced, was not available, and it was only introduced compulsorily in 1991, though many industries started accumulate or allowing their employees to accumulate super in the early to mid 80s, I'd say. And in those times, the majority of the women worked until they had a family, quite often taking their long service leave instead of maternity leave, and then returned to work once their children became teenagers, and then maybe only worked part-time. They provided a lot of the voluntary work in school tuck shops, libraries, community services while their children were young. And you have to remember that this is the age when they were working of power dressing and women being encouraged that they could, or out to prove that they could do anything. So multitasking was the norm. And so there's this cultural burden these women have grown up with, that they should be able to do everything. They should be able to have a family, work, assist in the community, and come out of the end of it feeling very satisfied. On an educational basis, the majority of women that we're seeing have certificates level only, though some have university qualifications, because remember at that time, university education was free. Where are they now? Now they're in their 50s and 60s. They only have about half of the superannuation that the males of equivalent age have. They have roughly about 200 to 250,000 put aside in super. So are facing a future that's going to be reliant on the pension scheme. And so hearing all of the news about the pension not being sufficient to live on, so they are worried. They find getting employment very difficult. Particularly after this long gap of caring. And most of them have cared for elderly parents after they've finished growing their own children. technology's moved on, and ageism is alive and well in the employment scene. Residentially, sort of their living arrangements, they're either living in houses that they can't afford to maintain or struggling to pay rent. If they're divorced or widowed, there's a high probability they'll be in social housing. And often there's been DFV involved at some stage in the past. And what we're also seeing is that there is often just one catastrophic event, such as a serious illness or a car accident, that's resulted in them having enormous amounts of bills, not being able to keep their job, and then becoming homeless. And it strikes them even if they're well educated. So we have a CFO who had a car accident, who then is not able to sit for long periods. The mental impact of that has meant that she is now back at square one. So education doesn't protect you from these catastrophic events. One incident can unravel your life. Those who are living on welfare support have enormous financial stress. We find that they can't afford to go out, struggle to buy petrol to come to our sessions, and we found until we started giving them gift cards to enable them to keep their phones on and have internet access, they quite often would only turn their phones on for that period when they knew we were going to call or when their family were calling. And so they are very socially isolated. Their world has shrunk. That shrinking of your world then impacts on their confidence. They don't even have the confidence to go out to join another group. It took us quite a while to get them familiar with coming to the university. And we'll talk a little bit later about the positives that we've seen. They're looking for a purpose in their work. And many of them are looking to give back to community, saying, well, I have these skills, I'd like to work in a not-for-profit, but then not realising that to run a not-for-profit is actually more difficult than running a for-profit little organisation. But they don't want to make $1 million. They're looking just enough to supplement their income and to be able to then have some sort of future and be a role model for their next generation. And I think at that point I'll stop and hand over to Dara to talk a little bit about the research that sits behind the program itself.
Thank you so much, Nancy, for that. So with the Sisters Project, I'll just give you a little bit of an idea of where the research comes in and what we are doing with the project. So as Nancy said, there has been a sudden influx of women over 50 who are finding themselves homeless, and some of the reasons Nancy gave, and they were quite real, and particularly within Queensland. On the Gold Coast, we were seeing that women were couch surfing. My research has always been within, looking at women's challenges in terms of their careers and work journeys, looking at what is it that motivates them. So with this, the whole idea was about self-efficacy and motivation that we wanted to actually start looking into. So with the Sisters Project in itself, it's a more of an action research project where we are using, this whole social innovation method to actually see the research impact of the same. So to give you a brief background about just some of the research that we looked at. So this whole idea in itself came through with how little grants given to women, how actually moving them into self-employment can actually change their lives, as well as the community development that plays a part, with that whole emphasis on bringing women together. So the research was the motivations as to what motivates people to go on to that entrepreneurial, or we call it a self-employment journey. Our sisters find the word entrepreneurship very,
too scary.
too scary. So we say it's a self-employment phase. So what is it that motivates them? So within the project itself, we start off with doing some surveys at the start, as well as interviews at the start to understand what has motivated them. So research normally suggests that for women to actually get onto that entrepreneurial space or self-employment space is actually negative experiences in the work or the personal environment, discrimination at work. So those are just some of the things that really get women to get onto that entrepreneurship space. From our research that we started to look at, we are doing it as a longitudinal approach. So we start at the start to do the interviews and the surveys. We interview and survey them at 6 months and at the end of 1 year. So we are trying to understand whether those motivations have changed. But alongside those motivations, we're using Bandura's theory to understand whether self-efficacy plays a part, because as Bandura argues, that without having that self-belief in yourself that you can do it, you are unable to persevere in your process of being self-employed. So we start with understanding where these women are in terms of their efficacy at the start. But we do that at the 6 months. So once they get into the program, they get 4 days of full training. We provide them a lot of coaching throughout the process. We do workshops that every month. We've got mentors from the Department of Employment and Small Business who register with us and who meet with our sisters once a month. And we've got business clinics happening as well. So there's a process happening from the day they join to, and they continue until we say at the end of the project or end of 1 year. So we find that efficacy does increase over a period of time, and so does the motivations as well changes. With our particular group of women, we found because they have come to these disadvantaged positions because of whatever their life circumstances have been, whether it's health, whether it's domestic violence, whether it's just leaving work for caring responsibilities, there's been a lot of discrimination that they have experienced. They are all on welfare. They are either at risk of homelessness or living in public housing. So we've got 2 cohorts, and we see that most of their stories have got a similar thread going there, with the whole idea that yes, they've all had work experience, left work for whatever different reasons, and now when they're coming back to work, they just have lost that confidence. And then because of the job market, and as research suggests, it takes 65 weeks for anyone over the age of 50 if they lose employment to get back into employment. And with them having those gaps in their work, it becomes all the more of an issue. And so we find that their confidence levels when they join us are pretty low, but they have actually increased after a period of time. However, one of the key things that we found within our research, or we are finding within our research, is that a lot of them take the first 3 to 4 months just to get to that level of, okay, I will be able to do it. They go back, they come back to us and they hide again because they are scared. And that we find that it is more common within the women who have experienced domestic violence and lost their confidence. They're very scared to surface. So it requires a lot of patience as well as a lot of flexibility within the program to handhold them and go, that's okay, you take your time, come back when you're ready. And so that really is something in terms of policy lessons, in terms of government lessons that we have found. It's important that there can't be a one-size-fits-all approach to any, to supporting these women. There has to be that flexibility in it. So yeah, there's lots to talk about, but I'll stop here and I'll let Nancy just talk through briefly about the policy.
So this group are both recognised as a priority group for both the Department of Social Services and for the Queensland Housing Services, because women over 50 form the majority of women in social housing. Housing and Public Works under their strategic plan, are very keen to be able to see social housing as a stepping stone back into other forms of housing, so rental and supported rental. And so they have been willing to freeze rent against any rental increases while these women are starting their businesses, because they want to encourage them. They are happy for them to work out of their social houses, albeit that they have to let the department know. So there's that sort of support from that side of it. Both departments are keen to learn some lessons about what do they need to do to enable these women to take that step, either back into employment, back into training, or taking a self-employment journey. And part of that is about this building the self-confidence. So is clear, and that requires a bit of counselling. It requires this training around recognising that you do have skills, even if they're not skills in the traditional sense. You've learnt a lot of techniques in managing a family that are transferable. I think the other implication that we've seen out of the COVID impact is that the job market may be harder for these women, but also the changes in job seeker have allowed these women to improve their diet, their outlook on life, their ability to have continuous internet, which is something most people take for granted, but they're usually doing it pay as they go. So I think there's some lessons, immediate lessons out of it for the big social agencies, but there'll be some longer term ones about how long these women need to be supported before they can be sort of left to go on their own journey of self-employment. So I'll stop at that.
Thank you, Nancy. So just in conclusion, so we've had around 44 women that we have trained, and of those we have got around 38 who are still continuing into the project. It has been an interesting journey for us to see, so there are about, I think, 15 of our sisters, we call them our sisters, who have already started their businesses. However, because of COVID, some of them have had to put a stop on, a bit of a break in their businesses. However, because of job seeker as well, on the side, they have actually been able to keep their motivations up. We have been doing research now also on what COVID has impacted on them. And surprisingly, it has been very positive for them. And so one of the key lessons from the program, through the motivations and the self-efficacy, has been to bring women together. They actually become each other's strengths. And we are noticing that there is that whole social isolation that Nancy mentioned earlier. So they are actually beating that social isolation. Getting those gift cards really help them to organize catch-ups, have coffees. The first thing that most women talk about in the interviews is like, oh, we can't even afford a coffee. How, so I don't even step out of the house because it's so scary, because how do you go somewhere and you can't afford a coffee? So giving those gift cards really just, it really helps them take that step forward, and having those networks, those relationships. And some of the women already speak about how they can actually benefit other people's business. And, it's like a little bit of network of businesses of their own, which has been quite an interesting thing coming out of this project. And other is the intergenerational impact that we are seeing. Just for them to come to the university, for most of them, it has been the first time. And they go, oh, I'm telling my son to go to university, or I'm telling my nephew, or I told my sister about, it was just so exciting to be, to just go to the university. At first they are very scared of the university, and our campuses are known to really be massive. And I get lost every time I go to the Gold Coast campus. So they felt a little bit overwhelmed. But after they have managed to get past that first time they come, They love it. They love to come to the university and feel a part of that whole university sector or structure. So I think that has been an interesting, result or an outcome of the project as well. So I'll just stop with a couple of examples from our sisters. One is, a sister who said, who came to one of the networking events, after this long break, we started having face-to-face events. She had a haircut and she was wearing a dress for the first time. And she said, I'm feeling so good. I had a haircut in years, and I wore a dress for the first time in 10 odd years. And just looking at that confidence, and she had her, a laptop and a diary with her, and she looked very businesslike. So just some of those things that you see. One of our sisters who was a domestic violence survivor, she had come to the project feeling very down, and she didn't think that she'll do it. She cried a lot in the first info session, and today she's running an online business. So just some examples which really make us want to get up every morning and do what we are doing. So I'll end on that note, and happy to answer any questions that you have. Thank you.
Thank you, Dara, and thank you, Nancy. That was a really wonderful presentation about this amazing project that you've created, Sisters Project, and I've provided some insight. Got a first question from Sophia, who wants to know, how are these women, does ethnicity, are you factoring in women of different nationalities or ethnicity into your selection of the cohort? And can I add a question to that? How do people join? How are women joining? Is it self-select, or are you actively seeking?
So with the project in itself, so one of the key things is that we are looking for women who have been in Australia for a long period of time, who are citizens of the country, or long-term permanent residents, or on welfare support, because of the whole idea that there are support systems for migrant women, there are support systems for refugee women, but we found that for the local women as such, there was no direct support. So this program was designed around that. And in terms of nationalities or just the ethnic background, we do have women from various different backgrounds, and we find that there are women who are from Samoa. And one particular woman talks about, and it is very different. So she's still with her husband as a carer, but it's the whole idea that the whole day she's expected to do everything. And the husband keeps inviting guests over and she has to do everything. So this project has given her the mechanism to just go, this is my work, I need to go. So she goes to the university to attend these sessions. Even for our reflections or interviews, she will make sure that she goes to university as though it is her work. So those kind of little differences we do find. However, overall, I think there is not much of a difference in terms of their experiences. It's just been that they have come to a situation which none of them had even thought it was going to come.
And we do have a couple of Indigenous women as well, but likewise it's more the same problem of not having the confidence to think that they have a future.
Can I ask quickly, what's the size of the cohort? Is that what? So I missed that. Sorry, if that I had a bit of a robotic glitch at one point. If you mentioned that.
So there are 44 women who have finished all the training and the core components of the program. And at the moment, we've got 38 who are continuing into the program.
That's great. That's a wonderful participation rate and a wonderful continuation as well. I have a number more questions coming in now. So Sherilyn has asked, how are you theorizing the research? Because it sounds like spaces such as the campus, the university campus, and material, dresses, haircuts, laptops seem very important.
So Yeah, definitely. I think some of the things that are coming out as outcomes of the project, in terms of theorizing, I think the key has been within the self-efficacy space and looking at the self-determination and the social cognitive theories as such. But we've also been looking at the World Health Organization's quality of life as well, how that has been improving. So we are charting that into the mix as well, and these simple things. And I think while you're looking at the material things, it's the efficacy that has been changing. So when you feel more confident, you want to, just dressing up for work every morning. So one of our sisters just recently said, she had nothing to get up to, like 6 months back when she joined the program. She was like, I don't have anything to get up to, so I can't get up in the morning. She gets up at 12 or 1 so that she doesn't have to see a long day. And now, just when we started this again for our 5th batch, she has been attending every morning, getting up at 8 in the morning. And she tells us that now I'm getting up at 8 o'clock in the morning to come to this because I'm feeling that there's a drive for me to, get on with things or to do something about it. So I think that all becomes a part of your confidence in your self-belief as well. So we are looking at it through that lens, if that makes sense.
Nancy, did you want to add anything to that?
No, I'm fine.
Great.
I'll help with the next question.
So Simone Filliger has asked, it'd be interesting to hear about the range of businesses. I was wondering this too, actually. And so first of all, it's a range of businesses. What are you observing is happening in terms of startup? And also, is there a focus on developing networks or peer support amongst the women that are building on the individual empowerment?
Yeah.
And then I've got one more, if that's okay, from Simone. And I can remind you if you forget, how do you approach the issue of structural inequality and ageism and sexism when they enter into the world again?
Excellent. Thank you. Yes, Nancy.
I'll answer the first part and then give Dara time to comprehend 4 questions in a row. So that we set up a deliberate network within the batches. So we started off with a small batch. So we've had 5 batches in total. And within those batches and now across the batches, we have encouraged and established networks between the sisters so that they communicate. Before COVID, they could go and have coffee together, but now they talk online or talk over the phone. So we definitely have achieved one of our goals, which was building that network and peer support between the sisters. And I think now they're understanding that another sister might actually be able to provide some service to their own business, not just peer support. So they might be able to work more closely together or more a symbiotic relationship. The range of businesses, we have everything from making homewares to online sales of homewares, pet care. We do have Aboriginal art and Aboriginal artefacts which can be tailored to express a story that you might request to be painted on a didgeridoo or on a boomerang. Or even having those boomerangs custom painted for events and weddings, flower arranging and event support, through to candle making and support and massages. So there's, and also then through to things like workplace or fire safety training. So there's a range of businesses. We don't constrain the sisters into one particular business type, if you like.
Yeah, and I think one of the key things that we are seeing is also support in the aged care. So many of them have worked as carers, and there's that whole push towards how they can contribute within that aged care sector. So one particular sister has got entertaining the elderly, in aged care homes. So things like that. So a range of businesses. And what we actually say when the sisters join the program is that they have to work with their passion, but then we get them to do the whole like a business model canvas to actually understand whether this is going to be a viable business. So we do a lot of those discussions during the training, but it has to be something that they are passionate about. So we don't do scripted businesses. So we do have a business in boxes ideas that they can choose from, but we haven't had any of our sisters actually, pick a business out of that. Some think either we have just got the businesses wrong, or, something that our sisters have come with a business idea. I know the other question was about approach the issue of structural inequality and ageism, sexism. Now, when they get back into the world, so that's like our next stage or next step. So by training and building the confidence, this was more of that internalizing or, within this small space to really help women to get to that next stage. But as a next step, we are going to start the transition planning, where we are going to start training our sisters for the real, when we have to retreat from this program in March next year. So what are they going to do next? So we'll give them a lot of those. We'll be inviting our career counselors. We'll help them with their resumes. How do you get to that next stage? How do you apply for any further loans for your business? What are some of those microfinance companies or government grants available that they can actually go for, and how do they actually prepare for it? So yeah, the whole structural inequality is a bigger issue, and I'm hoping that with the project and with working with the governments and talking about these issues with organizations could actually, or hopefully that would have an impact, but it's not the core of this project, unfortunately. And
we do give some training throughout the courses about how to give feedback, how to develop strategies that might empower them. So if you've got to go and talk to a supplier and dispute a bill or something, and you're too unsure of yourself to go by yourself, well, there are other strategies. You take somebody else with you. You prepare your dot points in advance. So giving them some of those skills has been very effective.
Thank you. We've got loads of questions coming in now. Sorry, so pace yourself. Get that drink of water in. We've got a question from Pew Pew who said, everyone's saying lovely things in the comments. It's inspiring, but do you have any negative impacts? Do you find that there are negative impacts on women who are participating, such as conflicts with existing routines, or maybe with a husband or partner interfering with the decisions that they want to make around their participation in this program?
So yes, not too many, because most of the women are single, but there are a couple of women who do have partners or do have caring responsibilities for their grandkids or for older children. And while I find that over a period of time, so that one particular situation, as I was talking about the Samoan women, was that her husband found it really difficult that she had to keep going. And there was a time for almost 3 months that she completely disappeared. She did not want to engage with us as much. And we kept in touch with her. We sent her details. We would love to catch up, because we catch up with them every fortnight for a reflection, like a check-in, just to see how she's going. And I think, over a period of 3 months, she must have found the strength to talk to her husband about what she wanted to do. They wanted to plan a holiday. She said, we can't do anything if I don't take that next step. And then she was back on the ground. And now she's successfully running her, pillow making business and selling it. So there have been situations with a couple of other sisters, but we found that they find that strength to overcome it. So we just say we are here to support you and your decision for anything that you want to go. So we never push anyone to, be a part of it if there are circumstances which just make them, if they have to leave, they have to leave. But we have found with most of our sisters that they find the whole support and that structure very important in their lives, and they have come back. So, but there are gaps with a lot of sisters due to various circumstances, during having kids who have substance abuse, looking after them, making sure that they are looked after, and then they come back because they're like, okay, now I can look after myself. I need to do this for myself. So yeah, thanks for that question.
Nina then has a question. Moving forward, what are the most pressing barriers for this project? And what would you like to do next? I'm going to add that one.
So I think one of the most pressing barrier for these projects is just making sure that we can make their businesses and help them to make their businesses flexible enough to cope with COVID and the changing restrictions of COVID over time. So if the COVID ramps up and down for another couple of years, these sisters have to be able to work online, market online, be able to purchase things, supplies online. How are they going to work around this in this arrangement? I think that's the biggest commitment that we have for the sisters. And what would we like to do? I think there's, so me personally, I think it's one of the next questions is about monitoring them longer term, because we can monitor them till the end of the project officially, but we will ask them to come back and talk to us every 6 months or even every year later on, because it would be good to be able to follow their journey and see whether the change in self-confidence has allowed them to do more things. Even if they don't continue their business, is it allowing them to go and join other social and community groups?
And I think one of the key things is about transitioning. So at the moment, a lot of our sisters are very much dependent on us, just the whole idea. So we moved some of our sisters from fortnightly we call them reflections, which is also part of the data that we are collecting, like a check-in, from going from fortnightly to monthly because it was just becoming too much. And a lot of them were quite worried that, even that monthly transition was hard. So to actually get them to transition out of the project, some of the, we know that some of the sisters are going to find it really challenging. And so that's something that we are working on. We do a lot of resilience and, workshops with the sisters, being resilient, doing self-care, and also resilience in businesses as well. We get our mentors to talk about the business ups and downs as well. So overall, we find that we've got counseling students from the School of Human Services who also join the program, who provide counseling, as well as they do sessions for our sisters. And overall, I think we are trying every way possible to prepare them for that transition. And as a next step, definitely we want to do this study longitudinal, and I'm more interested in looking at whether there is a labor market re-entry of these women back, either as business owners, but also looking at whether they have decided, okay, business is not for me, but I would like to go back into employment. Now I've gained the skills, I've got the confidence, and I want to take that next step. So we like to chart over the next couple of years how these 44 women are going.
That's wonderful. And I think that answers Ushi's question. And then Elise and Connie have both similar questions around how much have you identified or considered other organizations that you could link up with, or that you could link the sisters to sort of promote their business or promote their network even further?
Definitely. I think so in terms of there are a lot of other organizations, and one of the key things that we've been working on is to, one, identify what government organizations are already there, or government programs that are already there that are doing a lot of these things, and bringing some of those together for a discussion on that support that can be built around. And with regards to promoting those businesses, we haven't yet approached organizations about promoting business, but we do promote the businesses through our, we allow sisters to promote their businesses through our Facebook page for the Sisters Project. And we haven't yet opened up the link for within our website, but that's part of the plan as well, where they can actually start advertising. But yes, there are other organizations that we talk to all the time and make sure that if there are other supports that are available for the sisters moving forward, or during the time that they are on this program, that so we talk to a lot of those other programs as well.
Then we've got probably time, I think, for one more question, and that's from Beatrice. And Beatrice wants to know, have you thought of lowering the age, or perhaps introducing another cohort of women under 50 who are on social welfare?
Well, I can talk to that one. So the age limit of 50 and over was determined through the Department of Social Services, who are providing us with the grant money. Their actuarial analysis of their clientele, people who receive the pension and other supports, carers and disability, highlighted it. It's the over 50s. So that's where this project is targeted. That might be to reduce it to their 40s. That may be a step in the next research project.
The next projects, yeah.
Wouldn't that be wonderful? Yeah, to introduce tiers of different projects. I mean, I think this has just been such a wonderful research project, but also, action and research project. It's a really important area, and I hope that it continues to grow and flourish. And I think, would it be possible for me to suggest that, if people have got further questions, they are more than welcome to make contact with you. I've heard lots of chat in here about, connections, other research. Perhaps, this project could be the focus of a research for someone else within Griffith. So there's so much, I think, that could be done around this. It's really exciting to hear about the work that you're doing. And thank you for sharing it with us today. And thank you to the sisters as well for participating in this project.
Thank you for having us.
Yeah. Thank you for having us, and thank you for amazing questions. Got us thinking as well.
And I think we're going to be doing a podcast on this as well, aren't we? So that's,
yes, it's at the moment with the government for approvals. We do have a lot of approvals to go through.
So that's great. Well, I hope we can. And of course, that's just a chance for me to also plug our podcast again for those who've just come on. The Gender Card podcast has been updated again today as well, with a project on transforming maternity care. So can we just give a sort of an emoji love to everyone for this project and send some lots of thank yous and happy faces, because I really would love to just let Dara and Nancy know just how wonderful this was.